And we are recording this Zoom meeting with Walt Ludwig from Kenmore Mercy Hospital. We're waiting for a few people to join us on our meeting as we let them into the Zoom room. And we are also streaming this live on Facebook. And we are letting a few people in here and saying hello. See who we have here. I'm going to show the grid so I can see what's going on. Quite a few windows open here in order to coordinate this. But this is great. So welcome to all those who are joining us today. Mr. Eminger? Yes, it is. So if you can unmute yourself, Joe. Or that's not Joe Eminger.
I'm here.
Oh, that is you. Okay, great. So we have a couple of people have joined us, and we had a little bit of a mistaken email that went out. I was trying to coordinate something with my several programs that you have to do this on, and I added a second Zoom meeting and then had to cancel it. And unfortunately, it had access to all the attendees. And I sent out a series of emails right after that, but whatever. What's nice is, Joe, that we do have you here and we can start a nice conversation with Walt Ludwig and include all of the information that is pertinent to the town here locally, County of Erie, New York, and some of the things that are going on as a whole in Catholic health that is the umbrella company to Kenmore Mercy Hospital. So we're very fortunate that Walt Ludwig, the president of Kenmore Mercy Hospital, is joining us here today. He's been with Catholic Health for 12 years and just become president. Well, I guess it's been 2 years previously, but this has got to be a very difficult situation dealing with a worldwide pandemic as the president of a hospital. So we, understand that he has had a lot of challenges as he's joined and worked, with his great team of people over there at Kenmore Mercy Hospital, who have taken such great care of all the patients that have come in and out of there with either COVID-related challenges or not. You've got to keep up the normal day-to-day business. So we are live on Facebook. We've got a bunch of people in the meeting. Our town supervisor, Joseph Eminger, is also joining us here today. And Walt, I'll introduce you and let the program start. And I will let people in as they jump on, but no need to wait any longer because I know you've got a lot that you'd like to tell us and fill. And then we will allow some questions afterwards, and I appreciate those through the chat box. And then I will coordinate asking those questions of Walt Ludwig. So we're really very pleased to have Walt Ludwig, president of Kenmore Mercy Hospital, here with us today, Tuesday, April, the 20th, 2021, as a continuation of the COVID pandemic goes on and challenges all of us. Walt, thank you for spending your time with us here today.
Sure. Well, thanks for people joining this afternoon. I've been in healthcare about 40 years now. Graduated from UB back in the 80s as a pharmacist. I worked as a pharmacist at Niagara Falls Memorial. Then I was at Children's. I was the pharmacy director there for a number of years. I got my MBA. I got moved into some administrative roles. Kaleida formed. I worked at DeGraff at Suburban. I tried my hand at some consulting work for a while, came back here to Catholic Health 12 years ago, and I've done this. But I will say, in 40 years, this is probably the roughest year I've ever had in healthcare. And it's not over yet. The title says Lessons from the Pandemic. The pandemic's not over. So we're still working through, especially in Western New York. And I just want to take you through a few of things we've done and planning to do, and also give you some other information. So let's talk about some of the lessons of the pandemic, I'll talk a little bit about vaccines, and then just some changes in the business model that we've had here in Catholic Health and Kenmore Mercy, just as people really don't want to come to the hospitals much anymore. Not that they ever did, but they don't want to walk into this facility. So how can we take care of them otherwise? So I got a little scratchy throat here. I apologize. So I really look at hospitalizations. So, and this is, New York State Department of Health website puts out the COVID hospitalizations on a daily basis. And so, let's see, do I have a cursor? I do, okay. So you can see this is when everything started back in March. Definitely we had that peak, came down, over the summer, seemed like things were under control, came back in November, December. And now for the most part, seems like we have a fairly steady decline in the state, which, would reflect people getting the vaccine and, so slowly seeing that trend go down. So that all looks great. Unfortunately, where we live in Western New York, it's actually quite different, and we actually are experiencing a third wave here. So you can see, we had a big bump in the beginning in April and March. We did, tend to improve over the summertime. Again, went back up in November, came back down for a bit, but now are on our way back up again. And, in some respects, if you look at the number of COVID patients in the hospitals in Western New York, it's higher than it was back in the beginning of time where we really thought, this was a true disaster at that point in time. I mean, some of this is actually due to the fatalities. There are a lot more fatalities in the beginning than there are now. So just because people are living longer and staying longer in the hospital, in some ways increases, the number that we've had in these two peaks. And, we know a lot more on how to take care of these patients and what to do with these patients. And even if you look at the positivity rate of COVID in the community, you really can't compare this period of time to this period of time, just because there's so many more COVID tests available and being done now that I think right now we're at about a 5% positivity rate here in Western New York. I think back here was around in the 20%, but again, there was far fewer people getting tested back then. So, so we had a big surge back in March, April. We had to stop doing all surgeries. So really, this really represented almost all COVID patients. Almost our entire hospital population was COVID patients. We made the improvements, we're able to do surgeries again and such. So, but we didn't really get a lot of people coming back to the EDs, people coming back into the hospital. People just tended to stay away, And so then in November, again, we started getting the second wave. We had to stop surgeries again. So we had a pretty good number of COVID patients, but we also had a decent number of medical patients as well. And as we're going into this third wave right now, we have COVID patients, we're still doing surgeries, and we also have medical patients. So we're basically filling up all the hospitals in Western New York. Now, we've learned a lot from last year to now. We've, how we've changed our facilities, utilizing space, having people, knowing how to take care of these patients, has all greatly increased our ability to take care of a larger population of patients, but is still putting a stress on the system. So some things, we've definitely had to work on. There's a lot more communication, like in our system, in the Catholic Health system, we're 5 hospitals. And so back in, probably April of last year, we started a daily communication, really starting looking at, current stats, how many COVID patients does each hospital have? What's our admissions and discharges? What is it looking like in terms of arrivals and departures? How many positive cases are we seeing in our labs and in our EDs? And so keeping track of all that. Then we would try to trend. We actually worked with UB and worked on some forecasting models. So as we go forward at any period in time, we start trying to forecast out. We do 3 scenarios: worst case, best case, middle case, in terms of where we think things are going to be going over the next couple of weeks, the next month. And then we also look at a growth rate. So for the past 7 days, have we been increasing or decreasing? So this was last week, but you can see it's going down. So the growth rate's going down, but it's still positive. So we're still seeing more COVID each day, but at least it's getting near this line. This middle line is zero growth, so we're getting near a plateau, but we are still growing. And then, we also just have to look at our capacity. How many beds do we have? How many critical care beds do we have? And keep track of that. And then also our PPE. We want to make sure we have at least a 30-day supply of all different sorts of PPE. So we characterize that by green, red, or yellow. So really a lot more reporting and information we have to keep track of just to make sure we can take care of all the patients that we have here. And we definitely should probably know we had opened up St. Joe's, or changed St. Joe's into just a COVID-only hospital. So we're moving patients there. We opened up the St. Joe's Post-Acute Care Center. So people needed nursing home care after they were in the hospital, had COVID, we could take care of them as well. So a lot of different things we had to put in place just to take care of patients. So a few things that we really had to put in place otherwise, from the facility standpoint, we had to look at how can we utilize every place that we have available in the hospital. Here at Kenmore Mercy, we have an empty unit, which we really weren't using. We got that totally back in shape, had all the air handling systems redone so that you could have negative pressure and such, put all that in place. What we found is we would set up what were called red zones, which was if you just have a hallway and you have 10 rooms, so you have 10 COVID patients in those rooms, each time you come out of that room, you have to take off your PPE and change and wash, go back in. If you make a red zone and put all those rooms in a red zone, you go in there once and then you stay in there until you're ready to come out at the end of your shift, and you can conserve more of your PPE that way. So really setting up building walls and things so that we could set up red zones throughout the facility. Coming up with new cleaning systems, just like when Mosquito Joe comes to your house, we have foggers like that too in the hospital just to kill anything, any bacteria or viruses that are in there. Even if you would have told me, a year or two ago that I would have needed to rent a refrigerated trailer, to increase my morgue capacity, back last April, we had to do that just because we can hold about 4 bodies in our morgue here right now, and we were exceeding that capacity on a regular basis. And so, those are some of the difficult things you have to work through, but definitely some of the realistic things that you have to do to make sure you can take care of as many people as possible. The manpower needs are another thing. The way, that you saw that curve go up and down, our need for people has waxed and waned over the last year tremendously. And so, nurses aren't just standing around waiting for someone to hire them. We really had to work with nurses that we have everybody what we call work to top of role, so that, a nurse's aide could do as much as they could do, an assistant could do as much as they could do, and really try to stretch those people as best as we can. In our ICUs, at times we used a team approach where we had one ICU trained nurse and then 2 med-surg trained nurses working with them to try to stretch the manpower for that. We had to hire screeners, the screening people came in, people called donners and doffers who would help people put on their PPE and take off their PPE. It was quite a bit of work. And so we brought in nurses from across the country through what's called agency nurses. And you normally have to pay those nurses an additional $100 an hour compared to what you might pay a normal nurse that was working in your facility in order to come, because they're in such high need, they could make a tremendous premium by coming across the country to take care, come work at another hospital. Our specialty care, of note, Kenmore Mercy has one of the best intensive care units in Western New York. We were one of the first hospitals to require that the doctors that work in our ICU are board certified in critical care medicine. We're definitely the first community hospital in the area, and I think only Buffalo General did it before us. And so when St. Joe's became the COVID hospital, we had to move all our intensive care doctors to St. Joe's to take care of those patients. We moved a lot of our nurses there too, because we also were well skilled in doing something known as proning, which they found was very beneficial for the patients, which was instead of being on a ventilator, if we could take care of them while they're on their stomach for the most part. I know that sounds simplistic, but there's a lot of care coordination around that. Our people were well skilled in that, so a lot of our nurses went there too, and so we had to make sure we could still replace those folks with other people that could take care of our people. We had what was called a teledoc system, where we had regular internal medicine physicians in our ICU, and they would link up to our ICU physicians over at St. Joe's, who would help them take care of patients. And it really was like a computer on wheels. You'd take it through the ICU, and they would visit patients along with the doctors there. So make sure we could take our highly skilled ICU physicians and move them around the system as best as we could. Trying to get PPE and other supplies, again, a lot of logistical pieces to that. That's kind of was like a whole science in itself, and trying to get all the equipment and supplies we needed, but we never really had an issue without not being able to get in supplies. But we definitely had to go through a couple different ways of making sure we could conserve them as best as possible. We worked through things. If we had to reuse N95 masks, how could we re-sterilize them, things like that. The testing side, when this whole thing started, we didn't really have any ability to do COVID testing. At one point, we had 5 different platforms. In order, you could get yourself all set up, start doing testing in one with one system, then all of a sudden, those supplies were no longer available. So you had all the equipment, but no supplies. So you had to, every time somebody came out with another platform, you basically had to buy it so that you could always make sure you had enough equipment and supplies to do the testing. And some tests would turn around in an hour, some would take 6. Depending upon what platform we had available, if you came in our ED and needed a test, you could find out whether you had COVID in an hour, or you might have to wait there 8 to 10 hours before we could actually tell you what your diagnosis was. A lot of financial logistics in terms of keeping track of where we were spending our dollars, with the hopes that at some point the government might come in and provide us some funding. We have received some funding from the government, but definitely, just like any business, I'm sure, hasn't totally replaced all the losses or increased costs we've had due to the pandemic. Resiliency, as things have gone on, is really something we spent a lot more time on, which is helping the staff continue. Some people just don't want to come back to work anymore. They're tired of all this, handling this, wearing all the PPE, all the different, some of the negative outcomes for some of the patients and such, although also quite a few positive outcomes that help keep people going. We brought in counselors, and so we'd have counselors just walking through the nursing units in the different areas. Because we're a religious community here, we had a number of different priests and deacons and all here, also just spending time with people. And really, we also now have a website that any associate can go to get some additional counseling or get some information to help them if they are having some issues. We definitely, especially early on, had a lot of interaction with the community. People were bringing in meals and helping us with different things, so really just coordinating all that to make sure that we were able to utilize any sort of donation we had to the best possibility, and also make sure we thank folks for helping us out. And security as well, we definitely had a lot of issues with, we had to control who was coming in the building. We weren't allowed visitors at times, sometimes, and then if we had to screen people or keep track of where they came from, where they went, and also just a lot of different pieces had to be put in place very quickly as this pandemic continued on. So pretty much all these things we are still working through today. We definitely got some thank yous from the community. I know the the Kenilworth Fire Department here, they're the first people to come to us. They were supposed to have a fish fry, had to cancel it because of the pandemic. They fried up all the fish and brought over, I don't know, I think 250 fish fries with French fries and all. So that was very nice. That was kind of the first thing. But we've had, other vendors come and provide us with, meals and such on almost a daily basis. Neighbors have come and given us signs and things. This was actually last Easter, so you can see how long this thing's been going. And then just different things that keep the staff going, taking their pictures and funny poses and things like that. We also have a medical rehab unit is a facility where if you still need some medical care, you're not well enough to be discharged from the hospital, but you need a lot of rehab care. So the medical rehab unit, we can take care of your medical needs and your rehab needs. If you've been on a vent for 30 to 45 days, you need to go to a medical rehab before you can go home or even go to a subacute care. And so, here's some of our successful candidates after they were in our MRU for 2 or 3 weeks, being able to go home. And again, all that really keeps the staff going. But you can see this is the state dashboard. I think I printed this out on Sunday, so you can see Western New York, we've got the highest positivity rate right now, and the most new cases per 100,000. So for me, I'm hoping that, everyone continues at this point to follow all the regulations and that people get that vaccine, because that's the #1 way we're going to get ourselves out of this. And so definitely, it's still important that everybody wears a mask, when they're around anyone else. I'm not wearing one because I'm in my office at the moment, but still physically distance, washing our hands and stay home if they feel sick. And, most of this is really just common sense. I mean, people say, stick to the science. I mean, there's some science to this. The 6 feet for the physically distance, initially, was felt this virus was carried through droplets, and droplets could carry about 6 feet normally. So later on, they found it's also an airborne virus, so it can actually go further. But that's where the 6 feet came with. Wearing a mask, seems to make sense. Wash your hands makes sense. And definitely there's some politicizing of some of this. Is it? You hear people say, well, why do I have to wear a mask walking into a restaurant, but I don't have to wear it, while I'm sitting at the table? What's the difference there? I think in the end, you just want people to wear their mask as much as possible. Since you're sitting at a table and I guess eating food, you can't wear your mask there, but when you're not doing that, you should be wearing it. Why do we have to close bars at 11 o'clock or such? Well, I would say common sense would say, people still drinking at 11 o'clock at night may not be, still consider wearing their mask on the way home or such. Might have a few extra beers or such. I don't know, but all these things, I think as much as we can just do these 4 things will get us a long way. I, for about 10, 12 years, I taught healthcare economics at UB in the Masters of Public Health program. And this was one of my slides used to use about the variation in healthcare information, because when people say follow the science, very few people agree on what the science really means. I always look at this, these are all books about diets. They're all written by physicians or registered dietitians, so they're all written by except the diet code. I always throw that one in there as a joke. That's written by Leonardo da Vinci, I think. But other than that, these are all people professionals, well-educated, and they all have different ideas on what's the best diet that you should, utilize. What will help you reduce weight fastest? I used to ask the class, who thinks that, drinking a glass of red wine each night with dinner is good for you, or who thinks, having a piece of chocolate, dark chocolate is good for you, Everybody, there's science behind all that, but everybody has different ideas on what to do with the science. Just like, you hire two attorneys to, defend you in a case, they're going to go at it different ways when, there's the same set of laws that they're working on. So even though there's a science behind this, people are not always going to take that same piece of data and utilize it in the same way. So I think that's where you get some of the back and forth in terms of, what's the best way to go. But does wearing a mask, washing your hands, and being socially distant, does that improve things? I will show you that it definitely does, especially if you look at other sorts of infectious disease. Now, here's the flu statistics for this season, okay? So here is the number of positive flu lab reports reported to the Department of Health this season. This season is the red line. That is, nobody got the flu this year because everybody's been wearing masks and washing their hands and staying socially distant. This was last year's curve. This is the year before. I mean, you can see, and this is how many people actually were hospitalized with flu this year. Nobody. And I can tell you myself, I mean, through every winter, I'd probably have at least one or two colds or sore throat, or I didn't have any colds or any sore throats this year. And again, I just think it shows, when people do follow these recommendations, you can definitely make a change in how infectious disease works. Now, the COVID virus, is definitely more contagious than flu, and in some ways more harmful than the flu. But this definitely shows that we do follow these recommendations, we can have a positive impact on spread of infectious diseases. So how else are we going to get out of this? Definitely with these vaccines. Vaccines to the rescue, and it's great we have at least two right now. I think the Janssen J&J will probably be coming back, I would expect probably by next week, just because the number of adverse effects is so minute that I'm sure it'll just come back with a warning or some recommendation to certain types of people. I think it's probably going to be shown it may have had some effect on people's platelets who are predisposed to something. So I think they're just trying to determine who those individuals are. But the safety profile on the Pfizer and the Moderna virus are fantastic, and even the safety profile on the J&J is very good as well. And really, these two, the Pfizer and the Moderna, they're utilizing a new kind of delivery method called messenger RNA. Basically, a vaccine is really just either a portion of a virus or a killed virus put into some sort of transport material and injected into the patient, and that lets their body then develop an immune response to that protein. So when they actually see the virus, the real virus, then you've got some antibodies against it. So the Pfizer and the Moderna, they use a newer technology called mRNA, which let them, instead of having to start out with a virus, they could just create a protein once they knew what the DNA sequence was of the virus, and they could attach that to messenger RNA or mRNA, which would take it to the cells and have them develop antibodies. Actually, the J&J used a system which was used a little more commonly, which was take a protein or a piece of the virus and attach it to another virus, which a non-harmful virus, and then that would take it into your body and let your body develop an immune response to it, which actually lets you develop that virus much quicker versus the more traditional way, like a flu vaccine. And taking the flu virus, injecting into the eggs, that would then, the virus then reproduce in the egg. You'd withdraw the virus from the egg, kill it, or take a piece of it, and then utilize that to form a vaccine. So it takes a little bit longer. You have to, if there's any changes in the virus, then it's hard to make that change. Versus with the mRNA technology, if there are new variants, all you really need is to be able to sequence the genes, the DNA from that virus, and you could basically make a new vaccine in the next day. So it really is a much quicker way of manufacturing vaccines. Just from Johns Hopkins newsletter, they just talked a little bit about, because some people are concerned about how quickly those COVID vaccines were made. Definitely the mRNA technology had been worked on for a while. It actually had been used in an Ebola vaccine before this. This was probably the first time we really used it in such a large extent. You needed that genetic information. Well, China had decoded it already, and Israel had done some work, so that was very quickly available. Sometimes when you test these things, you do it in a serial method. You test this one thing, then the next. Here they did parallel paths in terms of the testing, so still the same amount of testing, just reduced it. The government gave money to the vaccine developers, so they're able to, invest in the resource they needed quickly, and also, it allowed the vaccine makers to actually start making the vaccine before it was approved, so that it would be ready once we needed it. I already talked about the mRNA. Also, it's very easy to get study volunteers for this through social media. A lot of people wanted to help, so there was no issue with that. And because the COVID virus was so widespread, it didn't take very long to see whether whether these vaccines were effective or not. So all those things made the ability to bring out these vaccines very quickly much easier than otherwise would have occurred. So if you're worried about getting the vaccine, I don't know. I mean, I've talked to many people here at the hospital that maybe had some reservations about it, and for the most part, most people I've been able to talk to went forward and got the vaccine, and I'm sure we're happy. I mean, when we first offered the vaccine to people here, people would come and get the vaccine and come out with tears in their eyes, not because it hurt, but because they're so happy to have that protection. The biggest thing I can say is there's been 210 million doses of vaccine administered in the United States. What have we heard so far? 6 people got a blood clot using the J&J, right? That's about all you've really heard as any sort of adverse effect, other than a sore arm, or you're feeling ill for a day or two. With the J&J, 6 people had this blood clot out of almost 7 million people getting the vaccine. That's pretty much about the same as your chances of getting struck by lightning this year. If you drive a car, everyone gets in their car, there's 40,000 deaths per year due to automobile accidents in the United States. So if people really think about it, the risk involved is so small. Even when you look at other drugs that people take on a daily basis, aspirin, there's 15 deaths per 100,000 aspirin users, has a lot of known side effects, develops ulcers, gastritis, bleeding, ringing in the ears. There's numerous drug interactions. If you take aspirin during pregnancy, it's known to have adverse effects on the fetus. So, I mean, aspirin compared to getting the vaccine, looks like the lethal drug, So hopefully, people spend some time and just, as we keep going on, I could see, I was offered the vaccine in the end of December. We were kind of the first group, so I could see maybe people being a little bit concerned, but it's 210, you're already late to the game, I would say. 210 million doses are administered. If something was happening, you would see it by now. And, it's really, the safety profile in this is so great that, I just find it hard to see why someone would not want to get the vaccine. Now, there's a statistic I read that, since COVID started, for every 100 people that died, just in general in the United States, 10 people died from COVID. So you can say overall then that your risk of dying has increased by 10% because of COVID in the area. Well, if you could take, who wouldn't want to get rid of a 10% increase in their chance that they're going to die, just by taking this shot? So again, I really think it's the way we should people should go, and hopefully people, seems like as time goes on, more and more people are agreeing to accept the vaccine. So once we got this vaccine, we set up these hubs to get the vaccines out. Western New York is in hub number 10. And so you can see the state set it up. Catholic Health was actually selected to run the hub for the vaccine distribution. Mark Sullivan's our CEO. As soon as he was given that responsibility, he also reached out to UB and ECMC and asked for their assistance to help as well. So it's kind of been a three organizations working together, and Kathy Hochul is kind of our lead in this area. Excuse me. From a government perspective. And so basically the state still determines where the vaccine is going, but they utilize the hub kind of to help out with the logistics of it and help us get it out to folks. You know, the hub really becomes like an incident command, and also make sure that we look at health equity. We want to make sure that we're getting this vaccine distributed on an equitable basis to all areas of Western New York. And so there's definitely an operations piece, setting up pods. There's a planning piece in helping the state decide where is the need the greatest. And there's a logistics piece in terms of, you know, making sure we can get vaccine where it needs to be, that there's the right sorts of refrigeration and things like that available. So it's been a lot of work to really make sure we can keep all this information going and help enlist people to actually distribute the vaccine. But in the end, the state actually determines where all those doses are going. So if you want to learn information about vaccines, there's all different places you could go, but actually Western New York has its own website called Vax New York. It's, you know, vaxwesternnewyork.org. I find just going there, there's linkages to the CDC and the New York State site and everything else you might want. But it's a quick and easy way to just get as much information, and there's a lot that's specific to Western New York. And if you're looking for a vaccine, and I will say when I started, maybe I started penciling a few comments about this presentation maybe 2 weeks ago, it was a lot harder to get a vaccine then than it is today. I don't think a lot of people who really spend a little bit of time looking for a vaccine are having that much difficulty. But if you go to this website and go to this locations box and you click on that, it'll give you a couple of options. One is the New York State Department of Health. I don't normally go to that to look for a vaccine. It takes you to a lot of different places. I normally go to someplace else which may link me up to that website once they find out where the vaccines are. So that wouldn't be my number one place. But these other two, Vaccine Finder and Vaccine Hound, they're actually very good websites you can go to. If you go to Vaccine Finder, it lists all the providers in your area that have a stock of vaccines. So it tells you this pharmacy has vaccine in stock or not, and then gives you contact information. And so if they're enlisting people for the vaccine, you can go to that, click on the link for that organization, and if they are giving out vaccine, it'll tell you how to get that. The Vaccine Hound actually lists all the providers who are administering vaccines and will link you to schedule an appointment. So if you go to that, sometimes you may get linked to something and they'll say no appointments. But for the most part, that's also a very good way. So between those two websites, those are two, I think, really good ways, especially now, of trying to find a vaccine, because I'll tell you, I look on them almost every other day, and there's rarely a day I can't find that I could get a vaccine within Western New York within the next 2 or 3 days. For those that like Facebook, this has been another really nice Facebook group. You have to go to it and ask to join it, but it's called Helping Buffalo Get Vaccinated. If you go there, these guys know the ins and outs of everything. You know, if you go there, they'll tell you, well, if you go on a New York State website, you know, they update it, you know, every hour at minute number 6 through 8. I mean, they know all the detail, and they're very happy to share it. There's people on here who's made their life's mission to get you a vaccine. So if you want the vaccine, there's some people where if you just fill out a form with a couple pieces of information about yourself, they will find you a vaccine and reach out to you. Now, I can't say there's possibly, you know, maybe there's some scam people out there, but from what I've seen I really have seen very little of that. And I will say it's a well-policed website. There's so many good people on this. If there is a scam on there, they kick it out right away. So this, if you're really in tough shape or you've got something, a difficult case or so, go there and these people will help you. I mean, they will find you a vaccine and be happy to do it. And then there's one other website, it's called Let's Vaccinate Buffalo. It's another volunteer, and all these things are done by volunteers. The website is Let's Vaccinate Buffalo, WordPress.com. They also have the Vaccine Finder and the Vaccine Hound connections here, but they basically list every person who's been signed up to give out the vaccine. So their contact is there. Sometimes it will let you know if they're actively giving the vaccine or not, but at least it's kind of, to me, it's like the ultimate list of who you could look for to get the vaccine. But what I like, if you are homebound, they have options for you as well, because sometimes there's some difficulties there. There are some home care agencies or some county governments that will get you a vaccine. And then also they have a good thing, and there's also a lot of pop-up clinics that, you'll see it. We're giving out the vaccine at the Key Center, for the next 2. That'll be in there too. So, through, I think I've given you four different places to go to. You can definitely find a vaccine. I bet you within an hour's worth of time if you go to these different sites. All right. I just want to spend a couple of minutes on, what are we doing differently now? Because now that, the pandemic's happened, we've had to change some of our business models. Even the consumers changed a little bit. They're used to ordering their takeout food online or doing things online or such. How can we change our business model to be more intact with that? And so we definitely have enhanced our whole digital healthcare program. We now have what's called CH Care on Demand. It's a urgent care program. You can see a doctor within about 10 to 15 minutes with no appointment needed at all. You can just go to either the Catholic Health website and click on Get Care Now, or you can do this through your phone if you go to the App Store and download the CH Care on Demand app. But it's a quick and easy way to get care. So if you didn't want to go to the ER or we're having an issue, 24/7, you can definitely get somebody very quickly. We're also using some of the same technology in the hospital. We have a stroke program, and a neurologist has to be at the hospital within 15 minutes as a stroke patient comes in. We now have things where the neurologist, we have a device that can roll up to the patient, check all his vital statistics. The doctor can even talk to the patient, but he doesn't have to physically be at the hospital. He can be working from his cell phone, see everything, see all the imaging and all, and meets all the regulatory requirements and actually provides a very high level of care. We've done the same thing in our ICU, as I mentioned before. Our home care company is doing remote patient visits through this sort of technology as well. Again, with all the COVID patients, it's tough sometimes to get to all the patients through home care, so this gives us another way of reaching out to patients through an iPad visit. And then for the physicians that are employed by Catholic Health, it's a practice known as Trinity. We have primary care and cardiology, orthopedics and such. They are also doing video visits through the same sort of platform. So really trying to start to develop a whole digital healthcare program for people that don't want to come to the hospital or come to the office for care. Also, we had to really increase our consumer orientation, our technology platform. And so in November of this year, we totally revamped our entire electronic medical record and switched to an electronic medical record called Epic. In a hospital, your electronic medical record is basically how you communicate with each other. And so I look at it as like, one day we all decide we're going to start speaking French around here, and it's quite a change. But within about 30 days, we were totally on board. So we picked Epic, who's actually used by 19 of the 20 best hospitals listed on U.S. News and World Report. And the nice thing about this program is if one of those hospitals has a protocol in there, like how to treat heart attack or such, like the Cleveland Clinic is in this, I have access to that too. So we can adopt all the things the Cleveland Clinic does, the Mayo Clinic and all. I mean, it's really a pretty slick piece of software that we're now using. It was a $120 million investment for the system to make this, so it's a substantial investment. But we think it's going to be the piece that really sets us apart from other health systems, because this is what we use in the hospital, but there's also a piece just for patients to use on a day-to-day basis. Part of this program is something called My Chart, where basically you can have your entire healthcare record on your cell phone or on your computer, whether you're in the hospital or you're in your doctor's office or in the park, any place you can get some Wi-Fi. You can keep see all your health information in terms of blood pressure. If you have an Apple Watch and it keeps track of your heartbeat or things like that, it could all be stored in there, and then you can download that to your doctor, things like that. You can schedule any appointments that you need through this from any provider that's using Epic for their program. Buffalo Medical Group is one large group in the area that does use Epic as their electronic medical record. You can send messages to your doctor, do a video face-to-face visit. If you live here in Western New York and your father lives in Syracuse and you're concerned he's not getting his prescriptions filled, or he's not, showing up to his doctor's office, if he gives you permission, you could see what's happening with your father and make sure he makes those appointments and does what he's supposed to do. So there's a lot of, I think, consumer-oriented things in here that we think will make people want to work with Catholic Health for their health care. We even have it for the hospital. If you come in the hospital, we also have My Chart bedside. We're trying it right now on one of our units, but we give you an iPad. On that iPad, you can check your own chart. You can see your vital signs. You can see your lab results. You can see what your doctor is writing about you. You can see if you're supposed to get a CT later that day. It can show you when that's scheduled. It shows you all the nurses taking care of you, all your doctors. If you want a snack or you want another blanket or something, you can ask for it on there. And even, we have Facebook, Hulu, Netflix, Solitaire. It's all, it's also an entertainment center for you. So just one more piece we're trying to do to improve just how we're taking care of patients and their experience in the hospital. From a medical care side, Kenmore Mercy is known as the musculoskeletal campus of excellence in Catholic health. We do the most orthopedic and spine work in Catholic health here. We have 24 orthopedic surgeons and 10 spine surgeons from 10 groups across Western New York. We were the first hospital in Western New York to get a robot for orthopedics known as the Mako. We now offer same-day discharge, overnight discharge, or inpatient stay for total joint replacement. We've been certified by the Joint Commission specifically for knee and hip replacements since 2011. We're one of the most active hospitals in Western New York for the number of total joints we do, and we have all sorts of services here. So as people didn't want to stay in the hospital as much anymore, or as we turned surgery on, turned surgery off, we really had to look at how could we take, because our biggest book of business here is actually total joint replacement. So you can see we work with a team really to move forward to move patients who wanted to, and a lot of people wanted to, move them to an outpatient experience for total joint replacement. So you can see in beginning of 2020, we really started actively trying to offer an outpatient experience for folks that wanted that for total joint replacement. We got up to almost a 50%. Then we basically had to stop doing surgery for a month or two. But when we came back, boom, nobody really wanted to stay around the hospital very much to get their joint replaced. We went right up to 85% now of our total joint replacements are done on an outpatient basis, meaning people either go home the same day or just stay overnight, less than 24 hours, and go home the next day. And so we were able to kind of work with our surgeons, work with our physical therapists, work with our nurses, change some of the actual facilities here to accommodate this. But it's been a very successful program for us, and something a lot of patients are asking for. So between the robot and outpatient joints, those are really the two number one things that people are asking for, and we're able to make that change and accommodate that. I'm going to spend 2 more minutes just for an advertisement, and then I'm done. So Just some final thoughts from our Kenmore Mercy team. You know, we have been the sponsor for the Gateway Harbor Concert Series. Unfortunately, they didn't have it last year. I don't know if they're going to have it this year, but that was one of our pictures from 2019. You know, as I said, we're the musculoskeletal campus of excellence for Catholic health. You know, we've got the hospital here. We've got a great medical office building here with a great primary care practice there, Kenmore Family Medicine, and some ortho and spine surgeons are in there as well. We've got the Macaulay residence, so if you need subacute afterwards, we can take care of you. And we've got an outpatient rehab site as well. We've got the whole gamut. If you really need more care, we've got Mooney's here too in the corner, so whatever you need, we can take care of it here. I just like people to know, when they think about Kenmore Mercy, we have continued to make investments here, and we're here for the long term. You know, over the last 8 years, we've invested $50 million into this hospital. You know, we built a brand new emergency department in 2013. And the nice thing is, you know, these are very recent additions. So we have very modern facilities. So we've got the most modern ER in Western New York. Well, I should say, I guess ECMC. They're the new baby, I guess, around. But we have a very modern 27 rooms, all private rooms. You know, meets all today's standards and surpasses that. We built an orthopedic unit on top of that when we built that. So that's a unit 24, all private rooms, again, meets everything. And I tell you, having those new facilities during this pandemic helped us a great deal because in the ED, we have a number of rooms that have negative pressure. So if somebody has an infectious disease, we can put them in there. It's not an issue. Orthopedic room having floor having all private rooms and also new air handling systems and all let us use that. We added 2 more operating rooms in 2014 to support operations. You know, the biggest thing is sterilizing instruments and things. So we revamped our entire sterile processing area in 2015. Redid all of ambulatory surgery in 2017. So we took the old ER entrance and made that a surgical entrance. And so if you were coming here for ambulatory surgery, come here, get surgery, leave. You never even have to go into the rest of the hospital if you don't want to. So that's a new service. We have the most advanced MRI in Western New York here. It's a 3T MRI, brand new in 2018. There's been no additional advances since then in the area. So need MRI, we're the place to go. And then we've been spending some time this year basically improving our infrastructure. So we're replacing our backup fuel tank. We're putting in 2 brand new generators that can basically, the ED has its own generator, but we can power the rest of the hospital with our fuel tank up. We should be able to button down here and take care of things for almost a week with the size of our fuel tank and what we would have in our own generator. So we're here for the long haul. We're really, you know, no matter what happens out there, we're going to be able to take care of folks. Lastly, I just want you to know, you should also, I'm very proud of Kenmore Mercy. You should be proud of Kenmore Mercy. We're actually one of the most nationally recognized hospitals in Western New York. We're the only hospital in the area to have magnet recognition, which means we've got the best nurses in Western New York. Only one other hospital in Western New York ever had this. Roswell had it, and they lost that credential. We've had it now for 6 years. We're going for our renewal right now, but I don't see any reason why we shouldn't get it. It means that 80% of our nurses here have to be 4-year BSRN nurses, which means they're the highest educated nurses out there. You won't find that for any other hospital. We're very proud of that. We focus a lot. My thought is you can have the best physicians in the hospital, but you really need the best nurses to make sure people have the best outcomes. And that's really what we focus on. The Beacon Award is an award for excellence in critical care nursing. Again, we have this. ECMC has it, but we're the only 2 hospitals in the area to have that. Again, we've had this now for 3 renewal cycles, so we're happy to get that. Really, the one thing we hang our hat on is the Leapfrog Safety Grade. And I wish this company would come up with a new name. Leapfrog, people are like, oh, what does that mean? But it's a third-party organization that rates every hospital twice a year in the country in terms of their safety profile. So what happens with patient falls and infections and wrong site surgeries and things like that. They started this in fall of 2012. Since spring of 2014, we've had an A grade consistently. We've never dropped off that A. The new grades are coming out next week, and I'm not expecting any change again, but there's no other hospital in New York State actually that has had a consistent A rating that long, and we're one of only about 40 hospitals across the country to meet that. So people should feel very confident when they come to Kenmore. They're going to have a safe care here. They're not going to get infections and things like that. We're a designated stroke center for New York State. We've got the Gold Plus Award from the American Heart Association for stroke care as well. We're approved by the Joint Commission. We also bring the Joint Commission back every other year to give us additional certification as a primary stroke center and for knee and hip replacements. That means not only do we have the state designation, we also meet additional criteria. And Blue Cross has given us a distinction center for both orthopedics and spine care. So a lot of great things happening here, and we work hard on keeping all these recognitions going. Sometimes there's some tough times though here at the hospital, and it's really the community support that really keeps us going. Back in the pandemic, one of the neighbors came with their kids and wrote some nice messages to our folks here as they came into our employee entrance. So it means a lot to us to really get that support from the community. And so on behalf of our 950 associates, I just want to thank the chamber and the community really for everything that you've done for us. It's been a great ride, and you can continue to count on Kenmore Mercy for years to come. Thank you.
Well, thank you, Walt. That was a lot of information. We really appreciate that. And I know that there was, some things that I definitely learned about the hospital. And even though I'm right down the street and thought I knew all kinds of things. So very, very interesting. We're definitely very lucky to have Kenmore Mercy Hospital in our community. Not every place has a community hospital like this with such a great background of Catholic health. So we're very, very fortunate. I've always felt that. I do want to give Joe Eminger a minute. If you want to, I can help unmute you here, Joe, if you wanted to, you got it. Ask any questions in particular, because I know that the town is looking to really promote getting vaccinated for the sake of our residents, obviously, but for the sake of our businesses and getting back to business. It's an important promotion that the town is going to really take an initiative with.
Thank you, Kathy. And let me start out by thanking Walt and his entire staff for not only the past year, but for the past 70 plus years. This is a real asset that we have in our community. And I think it became even more evident this past year by having Kenmore Mercy in our community, how important it was. And as someone who saw the doctors and nurses firsthand working in that environment early on, they're just an amazing group of men and women. And they are led by, of course, an amazing man himself, Walt Ludwig. And I don't know how you do it, Walt, but you do it, and we're very grateful that you're able to do it, you and your team. COVID fatigue has set in on probably everybody. It has for me. I'm sure it has for all of you on this call here. And but as Walt said, we still have a little ways to go. People are getting, I think, a little bit too complacent. We're getting ready. We're getting ready for the warmer weather. Going outside, and that's gonna ease things up a little bit. To make things feel better. Hopefully, anxiety levels will come down a little bit. But we also got to be understanding there are a lot of people suffering still in these times from COVID with mental issues and addiction issues. And we have to be a more understanding society in general, I think, and not be so quick to bark off the top of our heads if somebody says something to you. We're all under a lot of stress, and we gotta take care of those things. We've come a long way over the past year, and that's the good news in COVID. But I still don't think we know 1/10 of what we're going to know 5 years from now. And that's another reason why we got to be careful. You know, that we're going to be finding out a lot more. The medical community will be finding out a lot more about it. And we just got to be a little careful, you know. So as we hopefully move towards a more normal situation in the fall, and we start to exit out of COVID, you know, later this year, hopefully. We have the issue of getting people vaccinated. You know, I'm guesstimating. It's not a scientific fact. I don't have it. I wish I did have more scientific data, but I'm guessing probably 30% of the country, no matter what, isn't going to get vaccinated. Walt, do you have any information on that? Do you know what are there estimates out there of how many people won't get vaccinated for whatever reason?
Well, there's definitely surveys every couple of weeks in terms of, how many people say they want to get vaccinated or don't. I think I've seen it, the people that want to get vaccinated up into the 70s now. I don't know the exact percentage. I can definitely look it up and get that for you if you want, but it's definitely something, it's definitely been improving every month though.
Well, as the vaccines are proven to be safer, and I think the CDC and whoever, I think they may have overreacted on the J&J a little bit because, you know, I mean, they had 7 million doses and 6 people, had blood clots. 1 had passed away, as Walt shown us on his slides. You know, it's more dangerous to take aspirin than it is to get a vaccine shot. So hopefully that'll improve. But the town is going to, take the initiative for our community. We're going to go on an initiative to try and get vaccinated, encourage people to get vaccinated. We can't force anybody, but we're going to encourage that. And our angle is going to be working with Kathy and the chamber. Our angle is going to be to support our local businesses. Okay, so something along the lines of support local business, get vaccinated. That's the best thing that we can do as residents of the town and of our Western New York region. If everybody is worried about the small business owner, well, the best thing that all of us can do to support the small business owner is to get vaccinated. And we're going to take a more aggressive approach along those lines over the next month or so, and we'll be rolling out a program along those lines. How successful it's going to be, I'm not really concerned about that. If one person gets vaccinated that wasn't thinking about it, that's fine. That's a successful program. So we're not judging it by number. We're judging it by our message. In conjunction with that, obviously the before mentioned small business owners who are have had a rough time over the past year. We're going to try and offer them up some assistance in terms of grants that the town will be offering to small businesses through the monies that the town has been awarded through the stimulus, latest round of stimulus money that we're going to be getting from the federal government. I can't commit to a time frame on that, only because nobody really knows. I've talked to Senator Schumer's staff, and who's kind of he's kind of been the lead dog on this, and his staff is just as much in the blind as us. We're still waiting for guidelines from the Department of Treasury of what we can spend that money on. But one of the things I know we can definitely spend the money on is to help small businesses. And so we're Kathy has generously offered to serve on the committee when I asked her to help out, and we're going to be putting together a package to grant money, not loans, for grant money to small businesses up to a certain dollar amount, and we're still formulating our way through that. But again, hopefully in the next 2-3 months we'll get that money out. It's not going to save the day, for the small businesses, but if we can get these small businesses $5,000-$10,000 in grant money, it'll get them maybe 2 months of rent for where they're in their storefront, or maybe more. So we're working on that. We're excited about that. Um, but we still got to stay the course. And vaccinations is the way to go. I can't stress that enough. I got vaccinated, and my secretary Jeannie is out today. She got her second shot yesterday, and she's a little. She had COVID earlier around the time that I did, and she's struggling today. You know, she told me that feels like I have COVID all over again. And I said, I know. I said, and you will for about 24 to 30 hours, and more than likely. But I said you'll probably wake up tomorrow feeling feeling much better. At least I know I did when I got my second shot. I it did feel like you had COVID for like a day or so, but then you feel much better knowing that it's only going to last a day or so. And I'll just close with this. Walt mentioned something that kind of hit close to the heart when the vaccines were coming out, and I got my appointment, to get my shot. I got the Pfizer shot. Had to go to Rochester for it. I got the Pfizer shot, and I was like a little kid at a candy store. I was so excited. I haven't looked forward to something so much. Probably since I got married. I mean, it was just. I couldn't believe how excited I was and how happy I was. I mean, I literally had a smile walking in to get that shot, walking out on both shots, and it made me feel much safer. And just last week, my wife and I, who's also fully vaccinated now, we went out to dinner supporting a local Tonawanda restaurant for the first time in over a year. And, that's how you get things back to a little bit more like normal. You support local businesses is by getting vaccinated. And that's going to be our push over the next few months.
Great. Well, anything we could do to assist you with that as well, we're happy to help out with that communication effort for sure.
Well, you were on my list of people to call, Walt. You were yeah, you'll be getting a phone call. Thank you.
Sure.
Yeah, that's fantastic. And Walt, I did have one question. You might have mentioned this, and I because I am getting people who have said, I had COVID, so I don't think I need the vaccine. If you don't mind reiterating what your answer to me was on that.
It's a much more sustainable immune response by getting the vaccine. I mean, you're getting a certain dose that's going to elicit a certain type of response. And when people get COVID, some get it, some have a more difficult disease than others, and so you may get a good immune response to your fight when you actually got COVID, or you may not have gotten very much at all. So it's only by getting this specific dose that you get from the vaccine, you're going to elicit a certain response level. So.
Well, that's fantastic. And I'll be working very closely with Joe for the benefit of our businesses and obviously the benefit of our residents. I'm halfway through my vaccine protocol, so looking forward to it. Maybe not as excitedly as Joe, but I didn't go through what he went through at the beginning of this whole pandemic. That personal hitting home is what is changing some people's minds. If they know somebody and they realize that it could really save a life, when they're not affected by it at all, they have a different, viewpoint. So,
and I'd like to just add one more thing. Okay, people are catching COVID after they get their first or second shots. Okay, it's not 100% effective, but the key thing to remember is that if you get COVID after you have the vaccine, you're more than likely going to get a far less severe case. You're either going to be asymptomatic or have some very minor symptoms. So that's another reason why you get the vaccine. The vaccine itself is 95, 96% effective. It's not 100% effective. You can still catch COVID, and it is very contagious with the variants that are out there. So, but you're still far safer after you get the vaccination, even if you catch COVID, of not getting a severe case.
That's a good point. And you mentioned the variants also. The variants are something that are kind of sneaking in and slapping us in a way, because it's just, that's how diseases work. And it's very, very concerning. So I'm looking forward to working with you closely to blast this out and see what we can do to promote it. And again, like you said, if we can just have one more person get vaccinated because they, you know, they think that maybe what we said had some merit, then we've saved a life, or, you know, helped save, who knows how many people can be affected. So appreciate your time, everybody here. This was a very good call, and we did record it. We'll kind of make some clips of it and cut it down a little bit to put up, but I'll put the whole thing up on YouTube pretty shortly here. And then it'll be available also, maybe a shortened version, and maybe some clips that we can use for the town, for the promotion that might go out different ways. So we'll work with the town on that. And then we'll look forward to another speaker series. We've been doing these every month, and they're getting some good notice and traffic. So we appreciate the audience here today. And we streamed it live to Facebook successfully. And we'll put this on YouTube, like I said. And again, thank you to Walt, thank you to Joe, and have a great afternoon. And stay safe out there.
Thank you, everyone. Have a good day.
Thank you.
Thank you.
Thanks, Walt.